Friend, let me tell you about the one line item that just didn't make no dang sense. Back when we were self employed in the United States, both of us, our health insurance premium was $1,200 a month, $14,400 a year. Before a single deductible, before a single specialist, before I made a single phone call to find out if my OBGYN was even a network this year. Crazy.
So when Spreadsheet started planning this move, first question on the spreadsheet was, what does healthcare cost in Mexico?
Child, we figured we save a little money somewhere in there.
A little money.
But what we found was a healthcare system that truly cares. And as a Black woman, sis, that is not a sentence I knew how to say out loud until I lived it. So today, we're laying out exactly what we found. Quick side note though, I'm CC, PHR certified, 10 plus years as a Fortune 500 corporate recruiter. I was the gatekeeper, but now I work for you.
And I'm Tristen, full-time Puerto Vallarta resident, relocation consultant, and helping you navigate the logistics of the Overground Railroad. That's my lane. Oh, and spreadsheet operator also.
But of course.
Welcome back to the Real on Relocating Abroad, fam.
And the whole reason we do this is to let you know that we are gonna be okay, because we have options. Now, friend, let's get into it. 5 chapters today, built around 3 answers. Is it affordable? Yes. And chapters 1 and 2 will show you the receipts. Is the care better? Yes. And chapter 3 will show you the bedside manners. And as a Black patient, am I treated with respect? That's chapter 4.
And chapter 5? Chapter 5 is the one we did not know until we landed here. Stay all the way through, fam. It will change the way you look at the entire American healthcare system. Promise. Before we get into chapter 1 though, quick context. Mexico has been ranked one of the top medical tourism destinations in the entire world. We also cover this in chapter 5.
Child, look at you with the cliffhanger.
I mean, I'm learning from you and Spreadsheet. Chapter 1. Mexico has 4 healthcare lanes: public, local Mexican private, international expat private, and cash pay. Most Black expats or immigrants we know, including us, land in the private insurance lanes. You have one, which is the IMSS, which is the Public Government Social Security Health System. It's resident eligible, and you pay roughly around $400 to $500 US per year per person, depending on your age bracket. And you have number 2, which is your local Mexican private insurance. These are domestic carriers, so they're Mexican regulated. You pay roughly around $1,500 to $3,500 US per year per person, depending on your age and tier. Then you have your international expat insurance. These are US and EU headquartered global carriers that cover private specialists and premium hospitals here inside Mexico and worldwide. It's portable if you plan on traveling outside the country. And 4, cash is king. This is where you can go to private care, walk into a private hospital, pay at the desk, and walk out with your care and a receipt.
Friend, the cash pay lane is the part nobody on YouTube prepares you for. I mean, it's so reasonable that some expats skip insurance entirely and just self-insure with a savings buffer. We did the math a little differently though. Here's what we actually run.
International expat lane. We use VUMI, and it's an international major medical plan. It gives us access to a network of private hospitals and English-speaking specialists right here in Puerto Vallarta and around Mexico. And it follows us really anywhere we travel in the world. It's healthcare that actually cares. The doctors here, we've noticed, have better bedside manner, and they have nice clean facilities. Y'all should come check it out.
And the reason we run an international expat plan with VUMI is 2 things. Number 1, the premium is a fraction of what we paid in the States. Remember that $1,200 a month, okay? And the network covers the hospitals we'd actually want to be in, MPV, and if we travel. Similar coverage, better care, it's even portable.
12 months, real line items. I'll let the spreadsheet do the talking. CC, you got this one.
Friend, every video, this man and his spreadsheet. Tell me you didn't add a pivot table this time.
It's actually a portable table, not a pivot table. Thank you very much.
Whatever, you know what I mean. Friend, read that total again. $4,174 for 2 full-grown adults for an entire year. That number used to be our deductible back with our U.S. insurance. Now, bring that back to the opening. We were paying $14,400 a year in premium alone as self-employed business owners in the U.S. Add deductibles, co-pays, the dental nobody covered, the eye exam, the labs that came back out of network. Let's just call it $18,000 a year. All in. Same 2 healthy adults, different country.
Friend, that's $13,826 in annual savings every year. Compound.
Oh yeah. Child, that is your IRA funded. That's 3 round trip flights back home for the holidays. That's the difference between living above your means and living under them and still having money to save and invest.
And this is important, fam. We're just at the healthcare portion. We haven't even started talking about housing costs yet.
Ooh, child, don't get him and Spread Keisha started on.
We'll pull it.
I know you will.
All right. Chapter 3. Quality facts that surprise every client we walk through this process.
Quality fact 1. Hospital San Javier and Hospital CMQ here in PV both hold CSG certification, the highest clinical standard in Mexico, modeled right after U.S. hospital requirements. And if you look across the country, there are about 10 private hospitals that hold the exact same Joint Commission international accreditation Johns Hopkins holds. The standard isn't lower, friend, but the price surely is.
Quality fact 2. The doctors. Most specialists at the private hospitals here speak conversational or fluent English, and many of them completed fellowships in the United States. The standard of education here is intense. Mexican medical schools require 4 to 5 years of study, plus a year of internship, plus a year of mandatory social service, all before they even start their specialty residency. Your dermatologist here probably did her residency in Guadalajara and the fellowship in Houston.
Look here, child. That single fact reframes this whole conversation. The specialists you'd see here likely came up through the same teaching hospitals as the specialists you'd see back home.
Quality fact 3, the one that really surprised us. The average wait time for a new appointment with a specialist in the United States is around 26 days.
26 days?
26 days.
Child, I bet and went on to glory by then.
The upper room. But in our experience here in PV and in dozens of clients' conversations that we've had, it's typically 24 to 72 hours for a specialist.
Yep. Friend, when I called the dermatologist for a new skincare regimen, the receptionist asked if I could come the next morning. Not, we have an opening in 3 weeks, but the next morning. Chapter 4, sis. This question is the one that Black women carry into every waiting room. According to the CDC, Black Americans live nearly 5 years less than white Americans on average. Same country, same hospitals. Black women in the US are 3 times more likely to die from pregnancy-related causes than white women. The CDC tracks it. Oh, and this one's a trip. A 2016 study out of the University of Virginia found that half of white medical students and residents surveyed believed Black patients felt less pain than white patients. Child, not in 1956, in 2016. So the question we Black women take into the exam room isn't just, can I afford the bill? It's, will the doctor believe me when I say it hurts? Every time, every visit.
And that was a concern for you here in Mexico as well?
I mean, for the first 12 months, it kind of was.
Different country, different healthcare system, same concern traveling with you.
Yeah, I didn't know what to expect. I did prepare for it though. Let me tell you what happened instead. The last specialist I saw in the US, I walked in, filled out all that paperwork for the first 18 minutes. The doctor walked into the room probably about minute 32 of a 45-minute slot. Had his hand on the doorknob by minute 38, child. I still left with 3 questions floating around in my head.
In the US, we're just billing codes. She came home that day from that appointment and said, this isn't medicine. This is just a transaction.
And that is what we were leaving behind, friend. Now, fast forward 12 months in. Let me give you my list. Dermatologist, mammogram, dentist, the medical clinic for the basics. Every single visit, the doctor was patient. They took their time. They made sure that they were treating the actual issue, not just the symptoms. They wrote things down. They asked the follow-up questions. And some of those doctors gave us their personal cell phone number. Not the office line, but their cell phone. Call me directly if you have any questions, day or night. Friend, now I know you know that is almost unheard of back in the States.
Not never. That's not luxury, fam. That's the baseline of being treated like a human being in a medical setting.
That is what respect feels like, friend. And I can honestly say that Mexico offers healthcare that truly cares. Chapter 5, the one I told you to stay through. You ready?
Me? I stay ready. Me and Spread Keisha are already ready with tab 2 open. Let's get it.
Child, here's the truth that somebody doesn't want you to know.
Americans aren't avoiding Mexican healthcare. They are already using it. 1.2 million Americans cross this border every single year for care they can't afford back in the United States or even get access to. That number has been climbing for over a decade.
Read that out loud, friend. 1.2 million Americans per year. Now, while the American healthcare conversation was telling you Mexican medicine was something to be afraid of, over 1 million of your neighbors were already getting care here, quietly, without telling you.
Gatekeeping. A whole lot of gatekeeping.
Tijuana and border towns like Molar City serve tens of thousands of American dental patients a year. Tijuana is also the bariatric surgery capital for uninsured Americans. Cancun draws major cosmetic and medical travel. Monterrey is a long-running orthopedic hub. Mérida is growing as a cardiac destination. The infrastructure for serving American patients is already built. Already running.
And here's what we noticed 12 months in. The hospitals where the medical tourists go are the same hospitals we use. The doctors are the same. The standard of the care is the same. We just don't have to fly home after our care.
Look here. For 40 years, two things have been true at the same time. The American healthcare conversation has called Mexican medicine third world. And over 1 million Americans have crossed this border every single year to get the care they couldn't afford at home. Both things were true. Only one of them made it to the news.
And now you have the other one.
Friend, $1,200 a month. I can't let it go. This is what we used to pay for healthcare and was still afraid to use it. Here in Mexico, we pay a fraction of that. The doctor knows our name and they believe us when we say it hurts. The price went down, but the care went up. And the respect is what I didn't know I was missing this whole time.
We didn't move here just for the healthcare saving, but it sure don't hurt.
It sure don't. But we stayed because they genuinely cared.
Want to get a full breakdown on the healthcare? The Black Expats Mexico Relocation Greenbook, or the Blaxit Greenbook, is what we wish we had before we landed. It's 15 chapters. Chapter 6 alone, the healthcare section, covers everything you need to know and then some. IMSS versus private insurance, trusted hospitals, dental, medical, and health insurance coverage. The Greenbook is going to walk you through everything you need to land here safely and securely. Be sure to check it out. And be sure to comment for a guide below so we can send you the link so you can access it.
Just the word guide. We'll send the Blaxit Greenbook straight to you. $67, friend. The healthcare chapter alone is worth twice that. And the money that you would waste just trying to figure it out yourself, I promise you it's worth that $67.
And if you're past the planning stage and need advice or guidance on your specific move, then the Move to Mexico planning call is what you've been looking for. You get a chance to get on Zoom with us live and go through step by step a custom strategy to help you move to Mexico.
Friend, it's time for you to reside where you can thrive. Follow your freedom.